morning to you, John. Thank you for joining us on Weekend Dawn. Now, what is your reaction to the President's phased lockdown approach?
Well, obviously we welcomed it. You would know that about 2 weeks ago we put on the table our smart lockdown model, and there were very similar elements to the one that has been tabled by the President now. It is the right way to go. It's the right thing to do. We've got to open up the economy in a phased way to protect both lives and livelihoods. But it's all going to come down to two big things. One, unambiguous messaging from government on the regulations that are going to guide these things and the data that underpins it. We've got to build up far bigger data sets, which means we've got to test, trace and track in much bigger numbers than we have now, so that it informs how we're going to move through the various stages.
All right, I was actually chatting earlier to Andrew Fool about the 73,000 soldiers that have been deployed to help combat COVID-19. What is the DA stance on that?
Well, I mean, it's a bit curious, and we haven't got a full answer yet from the President on why there's a necessity to deploy the entire Defence Force during this period. Obviously, one would understand the deployment of medical personnel and the like in that, but I imagine it's to handle the logistics of managing a district-level lockdown, which is what the President has indicated he wants to move to going forward. But we do have some concerns. I'm sure you and the viewers are well aware that there have been a number of cases of abuse of civil liberties. The military are not trained in public order policing, and we've seen some very unfortunate incidents unfold. So in my conversation with the President, I've asked him specifically to address the issue around ensuring that the military understand what civil liberties are and how we protect and defend them in this time when they've been deployed in such big numbers on the street. What we have to always avoid as well is what's called the permanence of the temporary. And it must be made very clear this is an extraordinary measure, and it is certainly not going to be the way in which it's done in future.
Now, let's talk a little about the underlying structural defects, as you termed it, in our economy. How do you think it could be better handled in a way to still boost the economy, I mean, during this pandemic?
Well, obviously, the economy's taken a massive knock. I mean, economists say we've lost around about 13 billion rand a day in terms of lost economic potential. And obviously this means that the hard lockdown has come at a cost, but we do need to have it there, and we need to ensure because it has served its purpose. But it is absolutely essential that we start to open up the economy. But the economic stimulus package announced by the President is absolutely excellent. We still need clarity of where the money is actually going to come from. But what's also going to have to accompany it is deep economic reforms. And I think we've seen in the last 3 weeks just how vulnerable our economy is and just how vulnerable South African households are during this crisis. I mean, just 3 weeks of lockdown have essentially moved us towards a situation where families are starving and people's economic livelihoods have been virtually brought to a standstill. We need to make sure that we are able to build a far more resilient economy going forward, and that means we're going to have to make some deep reforms in our economy as a result of this crisis.
John, I'd like to bring in the Western Cape now being the epicenter of the COVID-19 related deaths at the moment. What is your thoughts on that, and how do you think the province is handling COVID-19 on the whole?
Yeah. Well, I think you've got to look at context, and context is always very important. So, yes, it is the new epicenter, but that's as a result of the fact that the Western Cape is testing 3 times at the rate of any of the other provinces. And so, as we've said from the beginning, if you want to beat this virus, you've got to focus on testing, tracing and tracking. The Western Cape has rolled out a very extensive program of screening and testing and are finding more cases. And so I think that the numbers in other provinces, particularly the Eastern Cape and the Free State, are underrepresented because they're not testing at nearly the rate that the Western Cape are. Obviously, the more you test, the more cases you're going to uncover. But it's absolutely essential that we focus on testing as many people as possible. We should be testing between 17,000 to 60,000 citizens per day, because that's going to build up the data set that you require in order to understand how you can move through those various phases from the red to the orange to the yellow to the green and the blue. It's got to be informed by data, because what you don't want to do is to open up too much based on insufficient data, and suddenly you have a spike that overwhelms your provincial health services. So it's very, very important that the other provinces catch up to the Western Cape in terms of the testing. And I'm sure once this starts to happen, you'll see more cases being found.
John, now given that the outbreak has crippled even some of the world's most advanced health systems, is your position on national health insurance still the same?
Absolutely. I think that we've already seen what a poor steward the government has been in terms of the public health care system, and why we've had to put in emergency measures to do it. Other economies have not had to do that. And it just shows that we've got to focus on how we strengthen the public health care response. NHI is not going to do that. And we're very, very lucky that we've seen the private healthcare industry come to the party in terms of assisting with both beds, ventilators, and medical personnel in this crisis. And if they weren't there, I think that we would have been in a lot worse shape than we are currently, being able to meet the challenge. So I think we're going to have to look at healthcare going forward. We need a universal access to basic healthcare for every citizen. And that is a non-negotiable. I think there's broad agreement that got to move to universal access. But I'm not sure that NHI is the correct response to meeting the need of universal basic access to healthcare.
So what would the DA like to see going forward, coming from government and specifically from the President, in handling the COVID-19 infections?
Well, I think the President's been excellent to date. I think that he's made all the right decisions. The hard lockdown, locking down hard and locking down early was excellent. I think it's also been very magnanimous of him to be able to provide a platform where our party has been able to feed in suggestions and ideas from the smart lockdown to some of the economic intervention measures, and that he's been willing to listen to those and adopt many of those. And that's a good sign. And I